We're going to go ahead and get started. I'd like to, again, thank everybody for attending on this Thursday afternoon. I am in a esteemed company today. We've got Winselow Tucker, we've got Sandy Costa, Lieutenant General Rick Lynch, and Lieutenant General Tom Bostick will be joining shortly. He's currently at attending a national engineering meeting and is jumping from meeting to meeting, so he will be on shortly. As many of you know, this is the Adapted Eye series, or something that are near and dear to my heart and Rick Lynch's heart. And they started, this is our 15th meeting. They started almost a decade ago when I was running a company called Wolters Kluwer. They sent me away for a week to a 1-week leadership development program where I met Rick Lynch. Rick was coming to the program as the U.S. Army sent all of their 3-star generals through this program. I was fortunate enough to have Rick in our program, along with 7 or 8 other CEOs. The second night, I think it was, we were out having some drinks. General Bostick, welcome. Rick is captivating. He's got his Woodford Reserve. He's smoking a cigar. I'm trying to get the smoke out of my face, drinking my iced tea. And Rick looks at me and says, "Bob, how come the pharmaceutical industry has such a piss poor reputation? Though your products and the devices that your industry, creates are saving my boys and girls' lives on the field of battle. It's a tragedy. What's going on?" Well, this was my moment, right? He just, had already shared with him that Katie Couric interviewed him on her 50th birthday. He's all over the news. So my chest goes out. I start waxing poetically about pricing inelasticity. I get about 7 seconds in, and I get a very curt bullshit. The pharmaceutical industry has got a leadership issue, no different than the US military had post-Vietnam. And he told the story about post-Vietnam, men and women went over, served our nation. They were coming back into the United States, landing in airports, changing out of their uniform in airports because the public was looking down on the US military. This was obviously very bothersome. The US military started focusing on fixing the image problem, and they focused on creating adaptable leaders with strong moral compasses. So much so that if you go to the 5 teaching institutions, West Point, Annapolis, the Air Force Academy, Coast Guard Academy, or the Merchant Marine Academy, and you read the cadet code, for example, at the West Point, it says, "Thou shalt not lie, steal, or cheat, or tolerate those that do." And Rick shared the story, and I believe it was 1980, the first year that West Point admitted women to the academy, that there was a cheating scandal. And there were 70-something cadets kicked out of West Point for cheating, 40-something for cheating, and the balance because their friends cheated and they didn't turn them in. And Rick shared the story that, thank God none of my friends cheated, or I would not have had a 35-year career in the US military, because at that time in my life, I did not have the moral fabric and the understanding of the importance of the not tolerating component of that. And so then he looked at me and said, "By God, if we can change the public's perception where now we're viewed as one of the most trusted organizations in America, we can certainly do that for the pharmaceutical industry as well." And hence we started these meetings where Rick brings together leaders from the US military. We've had President Bush and Laura. We've had Secretary of the Army, Casey, Secretary Shulkin from the VA, a ton of amazing servant leaders like Tom Bostick and others that have joined us. And we marry them with the leaders from the pharmaceutical industry, like the folks on this call. And we share those learnings to hopefully create more adaptable leaders with strong moral compasses that helps perpetuate the good that we're doing from an industry. So as we kick this off, obviously, Lieutenant General Rick Lynch will be moderating this session. This is his baby. He's joining us from Killeen, Texas. His wife, Sarah, is hiding in the background, but she's always a big influence on these meetings as well. We've got Lieutenant General Tom Bostick, who was in charge of the Army Corps of Engineers, among many other things that he's done in his illustrious career. He's got a great book, Winning After Losing, that we'll talk about later. We also have Sandy Costa, who's joined us. This is Sandy's second or third panel he's joined. Sandy was the COO of Quintel's, but also general counsel for what is now GlaxoSmithKline. He sits on several boards. And Rick, Sandy, and I have one thing in common. We all were married. We've got 3 wonderful wives. So Sandy, hopefully Jean can hear me. And please tell her hi. And I know Sarah can hear me. So Sarah, Rick, tell Sarah hi. And then we've got Winselow Tucker, the GM of the oncology franchise over Bristol Myers Squibb. Winslow is the epitome of resilience. He shared a story with me that I thought I would share because it kind of humanized Winslow for me. And he shared that during the pandemic, he trained a puppy. So if that doesn't build resiliency, there's not much more that will. But he did that while living with his daughter in New Jersey. He's an avid runner. And more importantly for me, Winslow, there's a lot of folks I know at Bristol Myers Squibb. I heard 4 different people saying, you really need to get Winselow Tucker on one of your panels. He epitomizes leadership and he's great to work for. Folks like Shane Lee, Reed McClung, Angela Martinez, Mike and Jaychuk, 4 separate folks talked about his compassionate leadership, his development, and that he would be an excellent addition to our panel. So we're very happy to have Winslow join us as well. This is an incredible panel. And now I'm going to be quiet because before Rick looks at his watch, and I'm going to turn it over to Lieutenant General Rick Lynch. General.
Okay, Bob. I love Bob Jansen. People know that. It's not an don't ask, don't tell kind of love, but it's a love for his passion and his commitment. As you said, we were together in 2010. What I find is the world's comprised of 2 kinds of people, talkers and doers. Most folks are just talkers. They say they're going to do stuff, but they don't do it. Bob Jansen's a doer. So we said, let's set up these adapt or die panels. And like you said, we've done 15 of these. We've done them on the beaches of Normandy. We did them at the Army Navy game. We did it at West Point. We've done it generally all across the nation and across the world because of him, because of his passion and commitment. And this is all about trying to improve the leadership of the pharmaceutical industry. So generally what we do is we pick a topic based on current conditions. And right now we all need to talk about being more resilient. The essence of being adaptive is being resilient. That's the essence of it all. So we just looked at and said, well, who are the right people to talk about being resilient, to make this robust panel actually useful to the folks that are listening to us? And first name jumped to mind is Tommy Bostick, great friend of mine. As Bob says, just published his book, Winning After Losing, Building Resilient Teams. It's a phenomenal book. It ought to be at the top of your list of things to do and read. I don't know personally Winslow, but I know all about him from the people that work for him. Candidly, it's all about reputation these days. And everybody who works for Winslow loves Winslow because they know he cares. They know he's an engaged leader with their best interest in mind. And the highest compliment I can give anybody is calling him a mentor. And Sandy Costa is one of my mentors. I've been blessed with Sandy in my life now for several years. He indeed is a guy I talk to once a month. When I'm going through difficult circumstances, I call Sandy. When I need advice, I call Sandy. So I'm just humbled to be on this panel. And candidly, I don't deserve to occupy the same space as these 3 gentlemen do, but I'll give it my best. So let's talk about being resilient. It's defined as being able to withstand or recover quickly from difficult conditions. And that's what we're going through right now. Many of you have heard me speak in the past. Most of you know I wrote a book entitled Adapt or Die about adaptive leadership. Right now, what we're going through is phenomenal. But even before this, with the pharma industry, I would tell you about the fact that the world is VUCA and the pharma industry is VUCA. VUCA being an acronym that General Casey talked about in one of our panel discussions. It's volatile, uncertain, complex, and ambiguous. And that's the way it was pre-COVID for pharma. You guys were deeply involved in mergers and acquisitions. You were deeply involved in changing expectations of patients. You all were conscious of your patent cliff. You all had competing pressures from shareholders and boards and patients and partners. You all were struggling with your pipeline. And oh, by the way, the FDA has a major vote in this, and all of us have experienced recently CRLs from the FDA, and that's all volatile, uncertain, complex, and ambiguous. And then we were just minding our own business in March of 2020. I was actually in New Jersey making a presentation to Eagle Pharmaceuticals. As we flew back, all of a sudden the news was ablaze with this thing called COVID and the beginning of the pandemic. And many of you heard me say this before, the national media is a national embarrassment. So I do believe that they amplified the issue to make people even more anxious and more afraid and more scared. But generally, we shut down our country in March of 2020. I tell people, because I'm a man of faith, I tell people that God was mad at us and sent us to our rooms. So we were in our room for 15 months. People were anxious, they were concerned, they were worried about their health, their family's health. Nobody was traveling. We were trying to figure out how to use this new technology called Teams and Zooms. This is all 15 months ago. We were trying to homeschool our kids. I still find it phenomenal when folks are working from home, their spouse is working from home, and they have 3 small children. They're trying to go to school from home. Those circumstances are difficult. And now we're in the phase where how do we recover from the pandemic? And the way we recover, it's all about leadership. I do a lot of leadership tours on American battlefields. I tell people it's all about the leader. It's not about the process. It's not about the product. It's not about the infrastructure. It's all about the leaders. And everybody on this call is blessed with the opportunity to lead. So what I want to try to do is give you some ideas on how you can become not just a more adaptive leader, but a more resilient leader. In my book, I lay out a lot of leadership principles, but the two that kind of are appropriate right now are focus on opportunities, not obstacles, and be an engaged leader. We all saw this evolve. We all saw how people reacted to the pandemic. Some folks said, okay, I got it. Let's figure this out. Let's learn to use the technology. Let's learn to understand people's circumstances. Let's learn to make the best of the bad situation. Let's make this an opportunity, not an obstacle. And I've seen people and corporations flourish during the pandemic. I've seen people improve their physical fitness. I've seen people improve their relationship with their family. I've seen people spend more time improving themselves with reading and researching. I've seen people reach out to friends and family that they haven't talked to in many years. I saw some people, establish boundaries. So they indeed had control of their schedule while they were home. They were doing good at time management. I saw some people becoming expert at learning to say no. Unfortunately, though, I saw just the opposite in many cases, both people and corporations. Some folks really struggled with the technology early on. We were still reverting to phone conferences. I coached some of my clients into using the Zoom technology or using Microsoft Teams. And in some cases, they did that, but they refused to turn the camera on. But over time, we got through this. We got better at Zoom and better at Teams. And candidly, in some cases, we got too good at it because now people are addicted to it. And that's where I'm seeing people struggling. The people have reached burnout. They turn their computer on when they get out of bed, and they turn their computer off when they go to bed. But during that period of time between turning on and turn off, they're working almost continuously. They don't know how to say no. So all these meetings that pop up on their calendar, they agree to participate in. And next thing you know, they're going from one event to the next event to the next event. And oh, by the way, nowhere during that period of time are they saying, time out. No, I'm going to spend time with my family. Time out. I'm going to take a run. Time out. I'm just going to rest, relax, meditate, and read. But it just went from one event to the next. And that was troublesome and still problematic. And oh, by the way, I saw a struggle with collaboration. Most folks that we talk to argue that they have increased their productivity during the pandemic, that they're actually more productive working from home. And that may or may not be true. I'm trying to work to establish some metrics to determine whether or not people have indeed been more productive. But really what I'm seeing a struggle with is collective productivity. And I do believe generally corporations are running at about 70% productivity collectively because of the Zoom world that we're living in. What happens is when we're face to face, we can have a meeting and then there's the post-meeting discussions. There's people gathering around the water cooler. There's people going out to lunch. There's people going out to a drink and really talking through, okay, what did you get out of that meeting and what we're going to do about it? In other cases, that's just not happening. People are going to the Zoom meeting shuts down and there's no follow-on collaboration. So the point is on this idea of opportunities, not obstacles. In the pandemic, some of us made an opportunity. In the pandemic, some of us made it an obstacle. We just got to figure out where we are individually. I think the major issue is making yourself resilient. Again, if the definition of resiliency is being able to withstand or recover quickly from a difficult condition, I believe that resiliency comes in 4 categories: physical resiliency, emotional resiliency, spiritual resiliency, financial resiliency, and social resiliency. And the reason I say that is because while on active duty, guys like Tom Bostick and I were focused on the Army's suicide prevention program. And in most cases, individuals who killed themselves for 1 or 2 reasons: failed relationships or financial considerations. And there was always some kind of drug and alcohol involvement at the same time. So to preclude that, we all got to be physically fit. We got to be emotionally fit. We got to be spiritually fit. We got to be financially fit. And at the same time, we got to be socially fit. So I just did a great job, Bob, with my 10-minute time hack there. So that's the end of my 10 minutes. And I'm going to turn the floor over now to Winselow Tucker. And Winslow, as I said, everybody that works for you loves you. So it's a privilege to have you on our panel. Ladies and gentlemen, please, Winselow Tucker.
Thank you so much. Hello, everyone, and I hope you're doing well and staying safe. As said, I'm Winselow Tucker, Senior Vice President for U.S. Hematology at Bristol Myers Squibb. First, I want to say I'm really grateful to be part of this forum today and participating with such an esteemed panel members. For my panel members who are in the military, I want to sincerely thank you for your service and leadership for the country, excuse me. Bristol Myers Squibb is a global pharmaceutical company. We talked about the reputation of pharmaceutical companies. I take real pride in the fact that we're committed to discovering, developing, and delivering medicines that will help patients prevail over serious diseases, and that we work every day to transform patients' lives through science in areas like oncology, hematology, cardiovascular disease, and immunology. Now, it's been an extraordinary time in healthcare, an extraordinary time in our company as well. I want to give you some context before I talk about resilience. For context, in late 2019, BMS was acquired Celgene. Now, Celgene is a company I previously worked for, and now part of BMS. We also, as BMS, acquired Myocardia Therapeutics. So that's 2 acquisitions. In a year and a half, we launched 4 new products in the US and expanded indications for others. So needless to say, there was a lot going on, not to mention COVID. So it has challenged all of our team and all of us individually with a lot of change. So when I thought about resilience, there are 3 things I really wanted to touch on today. The first is around purpose, and that's personal and organizational purpose. I think that's incredibly important to drive resilience. The second is around using the mission of our organization to drive resilience. And last is around perspective. So first, let me talk around purpose. There is research to show that individuals who have clarity of purpose in their life tend to be more resilient. And these are the individuals who were just described that can go through challenges, come out the other side, and they're stronger. They're not beaten down. They actually take something away from it. And individual purpose really allows you to keep a focus on your core values. I think embracing purpose allows you to see the bigger picture and even further. I'll share with you what my personal purpose is. My purpose individually is to make a better life for my family and my community. And I'll tell you where I got that from. My grandmother came to this country from Jamaica when she was 17 years old. and came with her sister with the idea she was going to build a better life for her family and her community. Watching her do that has put that purpose in me. When I think about my professional purpose, it's really, I have a passion for commercializing and launching drugs, particularly cancer drugs. I've spent, many years doing that because I realize the impact it has on patients. My mother is a 2-time breast cancer survivor, and I can tell you the impact she's had on our immediate extended family and community, I know means that what we do makes a difference for people. I think organizational purpose can be that grounding for teams as well. And so I make it a point that we focus on the purpose of our organization, whether it is a sales meeting, a town hall, a group meeting, because I think that's critically important. And during the pandemic, I thought it was important that we do that to keep our team focused on something bigger than themselves and to drive that resiliency. Now, fortunately, when we brought together Celgene and BMS, we were able to bring together companies that have similar purposes and similar cultures. Any of you who've been part of a merger or an acquisition know that it's about bringing together process, policy, systems, but at its heart, it's about bringing together cultures and people to work towards a common cause. And so that has been for us a key part of how we got through the pandemic and built resiliency. In fact, our theme this year is all around Together We Will. And that means that together we know we're stronger, we know that we can do more, and we'll overcome adversity and achieve our organizational purpose. That brings me to my next point, which is around how in the pandemic, it's important to go back to our mission. And I think that that also helps to drive resiliency. I said at the top, our mission at Bristol Myers Squibb is discover, develop, deliver products that make a difference in patients' lives. And I think in the early days of COVID, we had a decision to make about bringing our teams out of the field, not interacting with customers, because we know for a fact that that could put them at risk and patients at risk. And we then had to recognize, how do we keep people connected? That was around our mission and communicating. And so on a weekly basis, we communicated to employees. But more than communicated, we listened to them to understand what are the challenges, what are they facing, and acknowledge those stresses. And at the same time, how we can help them get past those and deliver on our mission. Now, I said that we launched some products during this pandemic. In March of 2020, the FDA approved a BMS product, Zeposia, for multiple sclerosis. In April, we had an approval for another product for myelodysplastic syndromes, or MDS for short. But what's important about that product is patients who have MDS have to have blood transfusions. This product helps them to become transfusion independent. If you think about what was happening at that time, there was blood shortages and everything else. So talk about tying the mission of the company to what we can deliver for patients. And that is what really kept us focused and allowed our teams to be resilient. And what I saw is that those that embraced that were able to see past the pandemic to the other side and realize that we're working for something bigger than ourselves, which I think is really, really important. Now, our company has an internal campaign which frequently reminds employees about why we do what we do. It's called Who Are You Working For? And it's pictures, it's videos, it's stories of patients that grounds us in that company mission. And for many employees, I know it ties to their personal mission, which I think is really important to drive resiliency. As we're coming back into the office, what we're doing now is seeing those pictures of those patients, and I can't think of a better way to welcome ourselves back. The last thing I want to talk about is perspective. As leaders, it's all about us driving perspective for our teams. When there are tough times, we have to ensure that we are part of giving that perspective for our teams. Throughout my career, I've honed my outlook and my perspective, being careful to separate my personal emotions from the decisions that have to be made. And while it's hard sometimes to do that, I think it's important to be transparent. So I'm very transparent, but at the same time measured in my response. I think about how is my opinion going to drive to the upside in a situation. So as leaders, I think that one of the things that we do most is drive perspective, model positivity for our teams. And so that doesn't mean being blindly optimistic, because I don't think that's what we have to do as leaders, but I think we do have to say, here is where we're headed. and show teams that there are opportunities with every challenge and that we can get to the other side because of our individual values, our individual purpose, but also the organizational mission. So I guess in closing, what I would say is, I really believe there's an opportunity for us as leaders to drive resiliency with our organizations. One, by reminding people to think about their purpose and reinforcing that organizational purpose. Second, by thinking about the corporate mission and helping them to keep focused on that, which I think is really important. And then lastly, by setting the perspective for them of what they're facing and how they're going to get over it. It's been my pleasure to have a little bit of time to share my thoughts, and I really look forward to the discussion.
Wow, Winslow, thank you so much. And I love the way you crystallized it to purpose, mission, and perspective. And it made great sense. You know, one of the reasons my wife and I got involved with the pharma industry is because the majority of you truly care. You're trying to make a difference in people's lives. And, you know, in our life, you know, we've been subjected to family and friends with cancer and many medical issues. So we just rest easy knowing there's a leader like you at the head of a major organization doing the stuff that's the right thing to do. And I tell folks all the time, you can do well while doing good. And I'm convinced that BMS focuses on doing good. And hopefully you're doing well at the same time. So thank you.
Thank you.
So there I was, running my way through the military, and people ask me, don't you miss the Army? You know, I don't, I loved being in the Army, but I love not being in the Army. And I've not been in the Army for the last 10 years. And the people that I loved in the Army, I still love to this day. And the next speaker is Tommy Bostick. And I mentioned, what he did with his book, but his career from the time he left the academy to the time he left the military was absolutely spectacular. To at one point in time, not just running the entire Corps of Engineers, but he and I were working together closely with General Rick Lynch, who was Chief Staff of the Army, and Tom was his executive officer. Ladies and gentlemen, my buddy, Tom Bostick.
Well, Rick, thanks. I really appreciate this opportunity, and I look forward to future opportunities working with you and the rest of the team. I want to thank the audience for being here. I feel like I'm a part of you because even after I left the military, I did a right turn and went into biotech, and I was a chief operating officer of a publicly traded company called Trexon. And then today I'm working with a company called Ginkgo Bioworks, and our chief executive officer was on 60 Minutes about 2 months ago, and he was being interviewed about the Moderna vaccine. And Moderna can produce about, if they produce X in terms of vaccines, working with Ginkgo, they can produce up to 50X. So it's been a wild ride. I appreciate all that the pharma industry has done in order to make a difference in the crisis that we're facing and hopefully getting out of. But I thought I would talk about resilience from an engineering perspective. And I've worked resilience from a people perspective. I was the head of HR for the Army and about 1 million soldiers and 330,000 civilians. And it seemed like they all had my email address, so I talked to a lot of them. But from an engineering perspective, I'd like you to do this. If you got a piece of paper in front of you, draw an x-axis and a y-axis. And on the x-axis, I'd like you to just write time. And on the y-axis, write functionality. And then draw go up about 3/4 of the way up that vertical axis and just draw a horizontal line. And somewhere in the middle of that horizontal line, draw a V and just dip it down, and then go back up to that horizontal line. And there near the end of that horizontal line, on about a 45-degree axis or angle, do a dotted line. Okay, so in the first part of that horizontal line, I want you to write the words plan. And then under the V, that's absorb. And then when the line goes horizontal again, write recover. And then that dotted line that goes up, right underneath that dotted line, adapt. So when I think about resilience, that's what I think. There's a certain functionality, and that functionality could be with a person, with a team, with an organization. They function at a certain level. And that level may be on a scale of 1 to 10, maybe about a 7. And it's everything's going along really well. And then all of a sudden a disruption comes in, and you're going to absorb that disruption. And what I like to say is you're going to bend but not break. Now, what engineers traditionally do is they design so that horizontal line doesn't bend. They design a wall that's strong enough to prevent the hurricane from sending water over the wall. And after a while, they're building these designs so strong that the hurricanes become so strong that you can't design against it. So you have to absorb it. You have to find a way to absorb it. And then you recover. And the key to adapt, this adapt and die panel, the key to adapt is really learning from those lessons. And when you adapt, that dotted line goes up. So now your functionality, which was here, it now is increased. You're operating at another level. It's sort of like when the president says, build back better. That build back better happens because you adapt from lessons learned. So that's resilience. And I say it occurs over time, but at any point in time, you're planning, you're absorbing, you're recovering, you're adapting. You can adapt all throughout that line. So I want to give you a real life engineering example of how that happens. The best example I can think of is the Mississippi River. And we had a disaster happen in 1927 when we had a huge flood on the Mississippi River. In fact, I was talking to Minister Chen Li, he's the Minister of Water Resources, during a visit to China. And he said, General Bostick, the flood of 1927 was a big flood. The flood of 2000, or the flood of 1994 was a big flood. The flood of 2011 was a big flood. And he said, General Bostick, which was the biggest flood? And I said, well, Mister, congratulations. Most Americans wouldn't know those floods. But the flood of 2011 was one of the biggest floods on record. And they don't know about that flood because not many people died. We had, in the 1927 flood, we had about 1,000 people die. We had 800,000 refugees. We had 16 million square miles of land that was flooded. This was really bad. So the Corps of Engineers was told to build the Mississippi rivers and tributary system. And the greatest amount of water that came down the Mississippi in our history was in 2011. But what happened was, anybody that does remember that flood, they remember there was a 2-star general that was out there and he blew up a levee. And what we like to say in the engineers is he operated the floodway. He opened up a relief valve right south of St. Louis. The relief valve was 5 miles wide, 65 miles long, and all of that pressure came out and it just relieved. And then we built the system back, we adapted, and now the system's stronger. So that's an idea of resilience. So how does that apply today and to you that are working out there? Well, you know, let's say that a person on your team has a bad accident, or something goes wrong and they have to leave your team. That's a disruption to your team. But if you've got people dual-headed, triple-headed, so they're learning, you're going to bend, because when that expert leaves, you don't have anybody that's as good as that person. And I think we can all agree with that. But if you've got people that are double-headed, triple-headed, that can step in and make sure that the organization, it bends, but it doesn't break, then you start to recover, you bring on new people and you adapt. So that's an example. During 9/11, I had the nuclear keys around my neck in the Pentagon. We almost broke then, but the country did bend, but it didn't break. And part of it is training a team that is resilient, a team that can take on, and what we were trained on is nuclear kind of attacks. But that same kind of training worked for 9/11. And so they can go from disaster to disaster because the team is really well trained. So that's how you build resilience. The other thing, when I was chief engineers, the Chinese locked down our systems in a cyber attack. So what happens when you're locked down? That happened to my publicly traded company when we had ransomware. Well, if you have alternate command posts, you have an alternate place you can work out of, that makes all the difference. So being able to jump, in our case, we're operating out of DC, but I operate out of a headquarters that was in Omaha. And we had backup databases so that we could shift the leadership and operate there. We didn't have to move there, but we could operate remotely there. And we had a plan on how we would be resilient. The last thing I'd say is I had a pulmonary embolism going into Iraq. And, I was really fit. And I didn't understand why this happened to me. I didn't even know what a pulmonary embolism was. But I ended up on Coumadin for 6 months. I still deployed, but I couldn't go into combat. I stayed in Kuwait, deployed a 25,000 man division. I came back, did my Coumadin for 6 months and redeployed for 15 months. But then I said, okay, well, I'm going to start doing triathlons. I was already in shape, but I said, I'm going to get in more shape because I was resilient. I lived through that and I wanted to get better. I wanted to adapt to be even stronger. And now I take shots if I'm on a plane that's going to go for a long distance. I drink a lot of water to make sure I've got hydrated, which I didn't do when I had the pulmonary. So those are some examples, starting with an engineer example, showing how it applies to teams and to individual people and to organizations, and how you and your team and you as a person can be resilient as well. And with that, I'll turn it back over to you, Rick.
That was amazing, Tom, and I knew that it would be. You actually were able to allow me to visualize a PowerPoint slide without showing the PowerPoint slide.
Yeah, Rick told me no PowerPoint slides, so I had to have you draw one for me.
You did a great job with that. And I just love your personal stories. That's why I highly recommend everybody get your book, because your book's just replete with great stories that make magnificent points. And it's funny because you know how close I am to my beautiful wife, and I know how close you are to your wife, Renee. But Sarah did have the opportunity to go to the University of Pennsylvania and study resiliency when they sent a series of senior spouses up there. And the major theme that they came away with was bend but not break. And you said that numerous times. And thank you. As always, Tom, every time you're talking, I'm learning. So thanks again. In my book, I talk about the importance of having mentors and being a mentor. And I'm just blessed to have Sandy Costa as my mentor. Now, a few years ago, another senior rep in the pharma industry introduced us. We had a great initial conversation, but I knew that we were kindred spirits. And we have every month for the last several years made it a point to hop on a call and just talk and just reconnect. And every time I'm dealing with something, I reach out to Sandy and say, here's what I'm dealing with. What do you think? And I get brilliant insights, brilliant advice. As Jansen said early on, I think one of his strengths is he married up. His wife, Jeannie, is 10 times better than he is. And we get to talk to Jeannie every now and then as well. Just like Sarah is for me and Renee is for Tom and Casey is for Bob Jansen. So ladies and gentlemen, my mentor, Sandy Costa.
Thank you, Rick. I'm so pleased to be here and I'm humbled by your words. I'd like to talk about 3 points when it comes to resiliency. And there's lots of descriptors, of course, for it: confidence, perseverance, flexibility, often courage, and always humility. Humility is really the sire of all virtues, in my view. And people are humble because they've come through difficult times and are humbled by that. My wife, Jean, that you spoke about, who's the wisest person I know, always reminds me that we all manifest our own reality. The folks on Madison Avenue, the ad folks, they're betting that they can get you to manifest the reality that you have to have their $100,000 car. And it was interesting. Jean and I went to a seminar on conscious aging a number of years ago. I knew we'd need it sooner or later. And a doctor got up who had studied for 20 years the lives of people who had lived long times. And he said after 20 years, the only difference he could find between people who lived a long life and those who didn't is that the long livers had an expectation that they would. The other thing I point out is that highly resilient people are optimists. Michael Seligman has written quite a bit on the whole subject of optimism. And he says an optimist is someone that when they come upon a problem, they view it as a bump in the road. When a pessimist comes upon a problem, they think it's going to last a long, long time. optimists have deep-seated sense of gratitude. They're grateful for the blessings that come into their lives. It's not like that with pessimists. They don't see the world that way, and they're often cynics. My definition of a cynic is someone who doesn't have any heroes. But some of the pessimists I know do have a hero. It's Darth Vader. They live on the dark side. And of course, for pessimists, there is one good thing for them. When they're sitting there saying, I'm not too smart, I'll never succeed, people don't like me. The point for them, of course, is that they're right 100% of the time. If you really view the world that way, that's exactly what will happen. My advice to you with regard to pessimists is stay away from them. Sometimes that's difficult because they're in your families. I had one in our family, and he was a nice enough guy. You'd sit down at dinner with him, and 10 minutes later, you were looking for a sharp object to end your life. And so I tell you, just make sure that you continue to be optimistic and stay away from pessimists. Of course, the second point I'd make is that adversity is the sire of resilience. The general was talking about the Mississippi, and Gina and I went up the Mississippi, about 20 years ago. And I went up to the wheelhouse one day with the captain, and I had noticed that there was one instrument that wasn't there, and it was a compass. And when I said, what are you doing? And he looked at me and started to laugh, and he said, Sandy, on any given day, you're either going upstream or downstream. And if you think about it, our lives are pretty much the same way, right? On any given day, we're going upstream or downstream. And so we have to recognize that adversity just shows up. We've all used this mantra more than once where you say to somebody, I can't make this stuff up any longer. And it was interesting because Mark Twain wrote that the difference between fact and fiction is fiction has to make sense, because we all know the things that actually happen in our lives are things that you couldn't possibly dream up. And if you think about it, this year, we've had some real interesting examples of deep-seated resilience. We had Tom Brady win the Super Bowl at the age of 42. We had Helios Castellanos, who had been released by the Penske team, win the Indy 500 at 46. And we had Phil Mickelson at almost 51 win the PGA, the oldest man ever to win a major tournament. And it was interesting. After the tournament, Phil said, I believed that there was no reason I couldn't do it. That belief inspired me to work harder. I underline the words, that belief. He believed in himself, and look what he did. And in addition to that, we had Arthur Muir, who became the oldest American ever to climb Mount Everest at the age of 75. About 20 years ago, I had a great chance encounter. I had met Dick Bass on an airplane. At that time, he was the oldest man ever to climb Mount Everest, and he was the first man to climb the highest peaks on all 7 continents, which is called the 7 Summits. And I said to him, how did you do that? And he kind of smiled and said, I just kept putting one foot in front of the other. And if you think about it, sometimes we have challenges that seem so huge that what you really need to do is break them down into little pieces. We need a lot of wins when we're in the area of adversity. And so give yourself some wins and just keep going. It was interesting. I had read an article about Naji Ali, who is a world-renowned long-distance swimmer. He actually swam from Alcatraz to San Francisco, something they said could never be done. And he said the same thing. He said, I just kept stroking. But the other thing that I found remarkable is that he doesn't hardly ever look forward to see where he's going, but he constantly looks behind him to see how far he's come. And I think that's something that we learn a lot from as well. One of the things that I found when I was leading people, and I'm sure you all who have done this have seen this, is that when things get tough, there are a lot of people who just simply believe that they're the only people in the world that have ever gone through something like that. And so what I used to do is bring case histories of companies into meetings so that they recognize that we didn't invent the type of problem we had, that it happened many, many times before, and you always find your way out of that. The other thing I find about highly resilient people is that they're fearless. And that doesn't mean that fear doesn't come into their lives. It means that fear comes into their lives, but they're not afraid. And the reason is that they recognize that fear evaporates when facts come on the scene. What most people do, of course, is when they're in a tough time, they kind of hunker down and hope it's all going to blow past. It never does. And then when they're not working with facts, what happens? The demons up here come up with scenarios that are worse than anything that could happen in your life. The Hindus call this the cave of phantoms. And so just make certain that in really difficult times that you're always looking for facts to deal with, which will keep that from happening. The final point I'd make is that there are spiritual aspects to resiliency. We are, after all, spiritual beings having a human experience. Most resilient people are steeped in faith. And there's really two types of faith in my view. There's the faith that we have in one another. And make no mistake about it, if you don't have faith in others, they'll never have faith in you. If you don't have trust in others, they'll never have faith in you. And then there's the spiritually based faith. Father Henri Nouwen, who passed several years ago and wrote a number of books, said that faith is radical trust. It's like trust on steroids. And I'm not talking about blind faith when I say that. For as another wrote, faith is rooted not just in the heart, but in reality. We mostly learn about faith, I believe, from mentors and exemplars. The greatest one in my life was my mom, Sandy Costa, who died at 97 2 years ago. And I took a verbal history. And when I had done that, she told me one story that I never forgot. And what she told me was that when she was pregnant with my brother and I have an identical twin brother. My mother always thought he was a very handsome man. And one of the things that she told me was that when she was pregnant with my brother and I, my father was in Germany and she was staying with my grandmother. And every day at 3 o'clock in this small Italian community in Brooklyn, someone from the family would go stand on the curb. And the reason they were doing that is they were waiting for the Western Union man to come with the telegrams. I mean, talk about the greatest generation. And she told me one day they handed her 2 telegrams. One said one of my uncles had been wounded at the Battle of the Bulge. He had 3 Purple Hearts and a Silver Star. Talk about humility. His wife didn't know he had won a Silver Star. They found it in the attic after he died. And the other telegram said that her youngest brother, an 18-year-old, had died at the Battle of the Bulge. And then she looked at me and said, Sandy, it's at moments like that you have nothing left but your faith. And I think that that's absolutely true. And the other thing, of course, is that faith spawns hope. St. Paul, I think, said the best thing ever on the issue of hope. He said, adversity produces endurance, endurance produces character, character produces hope, and hope never disappoints. But notice when he uses words like endurance and the like, what he's saying is hope is not a passive emotion. You have to have the will and the way to get through difficult times. The final point I would make to you all is that when you think about who we are divinely designed and really designed to overcome adversity. And if you think about it, from the inception of the universe to this day, there has never been another you. From this day into infinity, there will never be another you. We are truly unique in all the world. And so think about that the next time you're having a difficult problem. Think about the fact that we are all uniquely qualified for the lives we live. Be resilient and have faith, be courageous, and I guarantee you that your life will become a sea of reciprocal benedictions, that blessings will rain down upon you. Thank you, Rick.
Well done, Sandy. You always inspire me. And I've got a poster I bought because it reminds me of Sandy. It's here in my game room. It's a picture of an older gentleman. And the caption says, that's what I do. I play golf, I drink bourbon, and I know things. And that pretty much captures Sandy Costa and me as well. But well done, Sandy. Bob, we got, looks like 9 minutes left. I'll turn it back over to you and Ellen and see how you want to proceed.
Thank you, Rick. Thank you, Winslow, Sandy, and Tom. Very, very insightful and appreciate it. One of the most impactful parts of these meetings, from my perspective, are the questions that come in from the audience. So as I mentioned early on, down in the bottom right-hand portion of the screen, there's a Q&A button. If you have questions you'd like to ask the panelists, please type your questions in there. I will review it, or I'm going to try to review it. And then I'll tee up some of those questions for Elaine. And please be prepared to ask your question once they're teed up. Elaine, we've got a question from David Atchison, Chief Commercial Officer at Apellis Pharmaceuticals. Can you tee David up, please?
Can you hear me, Bob?
I can. How are you, David?
I'm good, thank you. And thanks for a great discussion this afternoon, and thanks to the panel. You know, it's funny, I can relate to a lot of the conversations, and especially Winslow. We've been through a lot of the same work that you've gone through. We just launched our first product, just realized our first $1 million in sales in the hematology space, and did all of it in a pandemic here. And I think we've done a pretty good job with it. But I have a question actually for the whole panel, and it kind of relates to not just the resilience throughout the last pandemic here, but it relates back to, Rick's book, Adapt or Die. And I've heard that discussion and been around Rick around that discussion several times. And one of the things that I'm interested from the panel is, do you see moving forward that the companies that really kind of did a pretty decent job, or maybe they didn't, but we went into this pandemic, we were all kind of forced into trying to adapt it to a virtual way of working. And now the world's kind of starting to turn around a little bit again. And we're kind of trying to work our way through how do you keep virtual and how do you stay resilient with people working from a distance as well and trying to manage that. And I just wanted your thoughts on if you thought we could all adapt to that and still work back and forth, and what you are kind of seeing in the marketplace today.
Yeah, David, Rick here. I'll start and then turn it over to my fellow panel members. I actually developed a survey that I send out to clients, the folks who work for the clients, and asked them, what did they learn during the pandemic and what did they do that they ought to continue to do? What should we stop doing? So it's a robust database, but at the end of the day, it comes down to the CEO and the president. I have some CEOs and presidents who say, man, we're going to find us a hybrid model because we learned a lot during the pandemic. And oh, by the way, there's some goodness there. And oh, by the way, there's some things we missed. So we're going to find a hybrid model and kind of mix working from home with working at work and find the right mix. I do have some leaders, though, who say, nope, I just want it to go back to the way it used to be. I didn't like any of this virtual stuff. I want it to go back to the way it used to be. And Canada, I believe that's a mistake. So at the end of the day, it's all about the CEO and the president, how they approach it. And any of the other panel members want to chime in on that one?
What I would say is that when I was, I think I'm muted. Yeah, okay. Before the pandemic, in our company, we operated virtually, which was really hard for me. I'd never done that. We didn't use Zoom. We just used the phone, and we never saw each other. And I finally came in. I became the chief operating officer. And I said, we need to meet. we got to go break bread together, go to the bar, do something, but we've got to build a team. And a big part of building the team is outside of work. So that part of building the team and the social aspect, that, going bowling or golfing or doing something with the team to kind of build that trust that was mentioned earlier, I think is really important. So I suspect it'll be a balance, but I lean towards getting people together. Not so much I think we've proven we can do the work, but I think that the human aspect of it is really important.
I might just add to that, that I actually believe that our employees will demand it. Will demand that we do something that is a little bit different, and we learn and we adapt from that, because it did help our employees to really see that they could do that. Now, I do think learning through this, though, we've also gotten better at how do we do virtual and keep our teams connected and so forth. So I agree. I think it's going to be a balance of both, but I think it's going to be demanded in the marketplace for employees and also companies.
David, thank you very much for the question. Thank you guys very much for the answers. We've got another question from John Hilton. John's one of my favorite marketers. He was at Gilead for quite a while, then went over to Ascendis. Elaine, can you get John on the screen, please?
Sorry, Bob, I've asked John to join us, but he's not on video. John, can you hear us?
I can hear you. Can you hear me?
Yes.
Excellent. Yeah, no, good panel discussion. I really enjoyed this, and partially my question was answered by the last or asked in the last question, but pragmatically very curious to hear what kind of practical advice would your leader presenters have around keeping people, I think, connected to purpose, which is key to keep them resilient, and managing them more remotely in the future than we've done in the past, pre-pandemic. And just any practical advice and best practices that you've used to keep folks connected, to manage by Zoom, to manage remotely well. And I certainly agree with the last comment too, that I think we're going to have to make these changes more in the future, and employees are going to demand it. So how do we all adapt and get comfortable with this quickly? Thanks.
Yeah, I'll tee it off. So John, what I've been trying to do, working with corporations from all walks of life, is help them define metrics so you can accurately measure productivity. See, right now, that's the problem. This is a soup sandwich. People say, yeah, I'm more productive working from home, or corporations say, I'm more productive, everybody's together, but you really don't have any quantifiable metric that allows you to substantiate that. So I think the essence of it all is, figure out what your purpose is, figure out what your mission is, but clearly define metrics where you can measure actual progress. Other panel members?
The only thing I'd say is that, we're intensely social beings. And I think we're finding that the longer we've gone on with people not being in the same room together, that we'll find that you do have to strike a balance, that we can't run a company remotely, that people need to have interactions with one another to really be fulfilled in their positions.
One of the things I think has been the benefit of, where we've been this last year is that there are a lot more, I think, relational leadership skills that have been developed. Typically at work, it's all transactional. You're coming into meetings, you're looking at statistics, you're closing deals. Relational leaders ask how you're doing. How are you personally doing? How's your family doing? And it doesn't happen as much when you're in the office. And I think when we get back together, I think those skills need to continue to develop, because it's made a lot of difference. In my own case, even with generals, it makes a difference. I remember I got a call one day from the chairman of the Joint Chiefs, and I was the head of recruiting. I was a little old 2-star general, and he called me and he said, "Hey, this is Tom Bostick?" And I said, "Yes." He said, "This is Admiral Mullen." And no, he just said his name. He said, "I'm Mike Mullen." I said, "Admiral Mullen?" He says, "Yeah." He said, "Great job on the recruiting mission. You knocked it out of the park this year." And then he hung up, and it was like, that charged me up for the next 4 years. But this, how are you doing? And thank you. And in seeing people online is different than I think what we're used to in a building. So I think that part of our purpose, to take care of our people and understand that they have these requirements for leaders to have a personal touch, is important.
Tom, thank you very much. I agree with that so much. And when you have somebody that you respect and they reach out and they say something, it does matter. I appreciate very, very much, Sandy, Rick, Tom, Winslow, your input, taking the time to meet with the group. We are at the end of the hour, but there are a couple things I'd like to share. I truly believe it's important that we share the combined wisdom of the folks that we are able to attract as panelists. And one of the things I like to do is, if anybody would like a copy of Tom's book, it's Winning After Losing, or if you like a copy of Rick's book, Adapt or Die, my email address is bob@zensights.com. Send me an email with your name and your mailing address, and I will send you a copy of their books. So I think I appreciate very much what they do. I think they're phenomenal reads, and I'm very, very happy to make them available for anybody that participated on this call. I'd also like to turn it over to Rick really quick to talk about our next in-person Adapt or Die meeting, because I'm ready, as Sandy, Tom, and Winslow talked about getting back in person. So Rick, can you talk about the Army Navy game and our next Adapt or Die meeting?
I will, but I'll remind everybody how much I love Bob Jansen. Here's another example of how he's talking and he's not talking, he's doing. So he's committed to allow us to go back to the Army Navy game again. This year it's at the MetLife Stadium as opposed to the Eagle Stadium in Philadelphia, primarily to commemorate the 20th anniversary of 9/11. It's on the 11th of December. Just like in every previous event, Bob and I are working hard to get a suite at the MetLife Stadium. Prognosis looks pretty good. We've already got 550 club level seats reserved for us, so that's a good thing as well. Generally, what we do is we have a panel discussion the day before. Bob and I are still thinking through what the right topic might be for that panel. Any ideas any of you might have would be very helpful. But we'll gather together at the venue, which is the Hyatt Regency Jersey City Hotel. We'll have a nice panel discussion Friday night. And then Walt Smith, who's phenomenal with the logistics for Zensights, he's arranged for bus transportation to and from the MetLife Stadium. So I'm excited. The last 2 times we did this, Army won both times. I think that's got a lot to do with us just being there. So I'm glad that Bob wants to do this again. There you go, Bob.
There will be some Navy representation, but they will be definitely outnumbered. It is a great event. We do have a tailgate that we always do beforehand. And the in-person meetings are very exclusive. We hold it to 60 spots. And I think they're amazing experiences, spending time with some amazing, titans of the industry and titans of servant leadership from the U.S. military. So again, everybody, thank you very, very much for your time. We're getting through this pandemic as a nation and as an industry. One thing to think about as the pharmaceutical industry's reputation continues to improve, ask yourselves what you are doing as a leader for your own companies and for the industry. And if you think about that, I think we can do a lot of general good and keep things moving forward. So thank you very much. Thank you to all of our panelists, and thank you for everybody for taking the time to attend. Have a great afternoon.